Welcome to the Beauty Talk podcast, where we dive into the world of beauty, wellness, and everything that goes in between. Today, we are thrilled to be joined by Dr. Elizabeth Perez, a board-certified physician and medical director at Très Jolie Med Spa. Known for her gentle touch and keen eye for detail, Dr. Perez is the leading expert in non-surgical cosmetic procedures, specializing in injectables and laser treatments. Her unique blend of medical expertise and aesthetic artistry, she is here to demystify some of the treatments like Botox, fillers, and laser therapies, showing us how these innovations can help us age gracefully and achieve natural-looking results. As always, a special thank you to our sponsor, G-Skin and Beauty Institute, for empowering the next generation of beauty professionals through world-class education. Visit gskinandbeautyinstitute.edu to learn more. Get ready for an enlightening conversation filled with tips, insights, and everything that you need to know for medical aesthetics. Dr. Perez, thank you so much for joining us today.
Thank you so much for having me here. I'm happy to be here.
Yes, I was just saying, I feel like even though we've gone over some of the conversations, I have so many questions. Questions, just like I'm sure everybody else as well, right?
Good. Well, I'm here to answer them all. So
I'm so excited. So let's dive right on in, right?
Sure.
We know that there's a difference between medical aesthetics and regular aesthetics, but
Correct.
What is, for somebody in the general public, I think medical aesthetics, I'm like, okay, it's probably a little bit more invasive, and regular aesthetics, I could just go in and get a facial, but what is the real difference between both?
There's a lot of variation, but for the most part, most medical spas offer, you're right, more invasive treatments. Most of them focus on things like injectables, so lasers, Botox. We do laser treatments, or often there is laser treatments, and other body sculpting, toning treatments. But for the most part, the biggest difference is probably the degree of invasiveness or actual medical procedures being performed.
Okay. And then when we're looking for medical aesthetics, when we want to go in and do more invasive, more, I guess, result geared treatments, what are the things that we have to look for when we're looking for those providers?
Sure. So super important. Always go to a place that's reputable, that has a medical director that's clearly visible. I think make sure that they have experience and, that their credentials are up to date. It's important to kind of suss out and make sure that the clinic staff members, seem knowledgeable, that you get a good feeling when you walk in, trust your gut. If you feel that something isn't quite right, probably it's not. But yes, important stuff, checking off the boxes with medical providers, making sure there's a medical director, making sure that you feel comfortable at the location that you're at.
At the location, that it's clean. Not only just aesthetically pleasing.
Yes. If you're going in for a medical procedure, no one's asked you about your allergies, your medical history, your medications, you should probably take that as a red flag.
A red flag for sure. So then are we getting these medical aesthetic procedures done by nurses, or can you be like a esthetician, maybe trained in medical aesthetics? How does that work?
That's a great question, actually. It varies by state. So in the state of Illinois, different medical professionals can do certain treatments. For example, nurses can do injectables, Botox, fillers, laser treatments, skin tightening, versus estheticians, for example, they are not allowed to inject in the state of Illinois. They are in some other states, but not in the state of Illinois. And their jobs, I think, for the most part, when working in medical aesthetics, are doing facials, kind of a little bit more invasive skin treatments like microdermabrasions, skin infusions. And sometimes if they're well-trained, they'll be doing things like Morpheus or skin tightening procedures. They might be doing microneedling, but definitely under the supervision of an advanced nurse practitioner or a physician.
A physician.
Or a physician assistant, correct.
Okay, so then we can't just go into just a regular aesthetics place and think that we're going to get these other treatments. We do have to make sure that there is a doctor present, or a PA in the state of Illinois that is going to be monitoring all of these treatments, because something that we kind of spoke about too is that the adverse effects of these treatments can be you
It's
know,
real.
it's real.
Real and permanent sometimes.
Yeah.
And so sometimes it's a minor inconvenience. Sometimes it's a known side effect. But events are actually, things that you don't want to happen. And while most of them are pretty minor in the grand scheme of things, there are certain unfortunate adverse events that can be potentially, very distressful for people.
Yeah. So you want to be sure that you're in a location where there is a doctor. So if something does happen,
Correct.
that you're in good hands, like you're in the right
For
place.
sure. For sure. You should feel comfortable, and you should be able to ask that question. Perhaps the physician is not on site every day, but you should feel comfortable that whoever is treating you has access or can talk about your treatment plan should there be any questions. For the most part, most nurse injectors are well trained, or I hope so. But there's always a need to, even among physicians, to sometimes chat with somebody else, or even I will talk to my nurse, like, hey, I have this going on. What do you think? It's always, it's always best to work in twos or more because you just get so much, it's just a better outcome for the patient.
Yeah, it's like a bigger scope.
Yes.
I can attribute it to like working at a hair salon when I first got out of cosmetology. There was, seasoned hairstylists that, hey, I just turned this girl's hair green. Like, what do I do? Which is obviously a lot less invasive than the things that you're doing. But I could see how like the collaboration,
Exactly.
with all the different experts can yield to better results.
Not just within our staff, but sometimes I'll reach out to our, our device, our reps with our devices, or I'll talk to another med spa and like, hey, this is happening. It is good to have that collaboration with other individuals because, you can't treat it all. You see many things, and the more you do any kind of treatment, the more you realize there's so much more, behind, there's so much more to any treatment than what I think meets the eye for most people.
Yeah. And we talked about like the different levels and how it takes a lot more than just taking a course and just reading a book. Then it's really, being in the field and dealing with the different textures of skin, ethnicities, age, all of that stuff.
So many variables. And it is true. There's a theory. We can all read, for the most part, we can read theory. And then there's just having someone in front of you. And it's not just the technical aspect of what you're doing. It's also the human process, the aspect. You have someone coming in, and it's not just like, I need my lines fixed and that's the end of the conversation. Great, I'll fix them, blah, blah, blah. Thank you so much. Bye-bye. But it's usually, there's like a human connection. You're talking to someone, you're really listening to what their concerns are, what, sometimes what people want isn't the best for them. And so you're really trying to make sure that you hear them out, that they trust you, so that when you do give them a treatment plan, it makes sense. Or it comes from a place where they feel like you've listened to them, because it's, otherwise it makes it for a very difficult treatment process or conversation, if the patients are like, what are you talking about?
Or even a long-term relationship. Right?
For sure.
I mean, you would hope that you can continue to stay young throughout, your aging process. So developing, just like, a gynecologist or your hairstylist.
For sure.
You need to develop that connection with your, with your doctor that's doing all of these different modalities to your face. Like, you want to feel like not only are they providing a service, but they actually care about who you are, you know, and all those concerns. Because as we talked earlier, that was something that really, really attracted me to you. Because,
thank you.
I had a treatments done before where I was like, okay, that's what you want. This is what we're going to do. But I had no knowledge. It was my first time ever doing anything. But when I sat down in your chair, it was like, I remember coming in thinking I needed a whole facelift. And you were like, hold on,
No, you don't.
So I appreciate the way that you practice and how you do educate and bedside manner. I think is like, as women, sometimes we just need somebody to talk to, somebody to tell us things aren't all that bad.
They are
We're
not
gonna
that
hook you up. Don't worry.
Yes, exactly. I think the older you get, the more comfortable you get, the more that becomes actually the most fun part of my job is actually just meeting people, listening to them. You get to hear a lot of stories, and sometimes what we do is just a catalyst to get them to the next spot in their life, or maybe it is just their maintenance, but you never know. And it's always more than we as a provider think. People come in with a lot of things in their mind, in their soul, in their heart, whatever you want to say.
Yes. I mean, you just gave me the chills by saying that sometimes you're the catalyst, because I think as women, we try to control, our hair, our makeup, the way we dress in order to get into that next level. So it's so beautiful that you not only acknowledge that, but you're harnessing this and saying like, okay, there's way more to this, than just an injectable or a Botox or a laser treatment, which I think is so invaluable.
Thank you.
I think it's so beautiful, really, because we all need that little perk sometimes,
We do.
And in the beauty industry, I think that not only are we providers, but we're also like a mini therapist. Right?
Yes. And some of my staff members will be like, "Are you done, Dr. Perez? It's been an hour." Well, maybe not that long, but yes, you do so much listening. I mean, we can talk about what it means to heal, and I never thought of myself as a healer, but the more I'm in both the medical field and medical aesthetics, the more I feel like a healer. Like I heal perhaps your aging wounds, but I also can, just being together and talking about things and chit-chatting and just talking about life, you can reach just a new understanding. And I know it sounds like cliche or whatever, but really there is some, not all of my visits are this way, but I've had some really wonderful conversations with patients that are nothing to do with what I'm actually doing. The Botox is like, kind of becomes brainless, or not mindless. I'm not saying that, but it's, I know what I'm doing, but it's all the other stuff that someone has to come and tell you, it's the whole back end story of why they're even in my chair to begin with. Yeah.
So when these patients are considering Botox, fillers, lasers, are there any contradictions or people that are not candidates for, like, we can start off with Botox?
Sure. Yes. I mean, a medical history should be done prior to receiving any kind of invasive treatment, regardless of whether it's in a medical aesthetics or any kind of field, medical field. And there are certain conditions that would preclude you from getting Botox, and others that you just have to take into consideration. You might have slightly increased risk of maybe infection or maybe bruising, and then just not even medical factors, but just looking at someone's face. Not every, people watch videos on TikTok and Instagram and they want X, Y, and Z. And I'm like, well, you're not the best candidate for that because of this and that. Yes. Although Botox is quite simple and overall very low risk, there's also things that need to be considered before you provide or offer that service to a patient.
Okay. And then, so moving on to fillers, because we're all obsessed with them,
Yes.
We were just talking about how, the different trends and how we all wanted lip fillers, and now we're doing the facial balancing and all of this. So are there also candidates that are not, or patients that are not good candidates for fillers?
For sure. Same, and even more, it's something more to think about with fillers, because fillers are an implantable gel and they're considered a medical device, actually. And yes, they stay in your body. They stay in your body for months, sometimes years, depending on each person and their metabolism. And so when you're going to do a treatment that can be long lasting, you really want to be sure that you're doing the right thing for the patient, right? That you are actually offering them the right amount, the right location, and making sure that they are the right candidate. There are, unfortunately, while fillers can do amazing things, they can also come with the risk of, adverse events that, you would like to avoid as much as possible. Yes.
Even something as simple as like filler addiction.
Oh my God, yes. We have
like
those.
somebody to say like, hey, just because of it, I'm looking for your best interest. Maybe we need to pump the brakes on the fillers.
Yes. There are many times where I've had to tell patients, okay, no more, what are you trying to do? And again, beauty can come in, who's to judge what exactly is beauty? Not everyone has to be a cookie cutter, but then we have to have a conversation. Like, what are you trying to do? Are you trying to make a statement with your lips and you want this proportion, or are you trying to stay in harmony and you want to look more traditional, cute, balanced, correct, harmonious? And if that's the case, then maybe we've crossed the line. Or if no, that's what your look is. You want these, very large lips relative to the rest of your face, then so be it, and sometimes I'll do them, sometimes I won't. I've actually told patients, I don't think it's in your best interest to do this. So
to do something like that.
Yes.
Yeah.
I'm like, sorry.
I know. I bet
Sorry.
it's tough, right? I mean,
It's tough.
and unfortunately, I know that a lot of these patients will probably seek somebody who doesn't really keep them in mind, and but it's always good to know that not everybody is eligible. So always have a really great consultation with the doctor.
For sure.
Ask all the questions, tell them all the things. There's no reason why you need to be gatekeeping your health, the medications you are, the supplements, the treatments that you're doing.
Correct.
Because at the end of the day, you're here to help us.
For sure. And please let me help you.
Yes.
Help me and I'll help you, kind of a deal. And it is true. Sometimes patients are afraid to tell me certain medical conditions. And I'm like, no, I need to know that. That was really important. You failed to mention that you were going, you had cancer and you're going treatment. We can't do these invasive. I know your face is maybe not looking the way you want it because of your treatments, but this is not the right time to do something this invasive. Yes.
Yeah. So honesty is key, guys. Okay. She's here. And plus you can't say anything that you say in the practice anyway.
Yes, I can't.
Yeah. It's just called HIPAA. So, I'm just
not going to call anyone. I'm not going to let other doctors know anything, but
your secret's safe with Dr. Perez. Okay. Yeah. So just keep that in mind.
Yes.
And something that I know that has been, and I don't know if this is a trend or if this has just been around for a long time, but lasers, ladies, lasers. Everybody's talking about it. I've personally seen on women that I'm like, what are you doing? I want to know your night regimen, your day regimen. Do you do something midday? And every single time it's, oh no, it's a laser.
It's a laser. Yeah. I think, lasers have been around for decades, but probably, they weren't that popular. They weren't really marketed to the general audience as they are now. You can achieve amazing results with laser. I agree. It has actually become one of my favorite treatments to do. I used to do, for example, laser skin resurfacing, mostly on young people for acne scars. And it was life-changing for a lot of them. Can you imagine if you've lived with acne scars, you've been trying to hide for years, and suddenly we're smooth out your face 80%. People are in heaven. Or you get rid of, not just scarring, but some of these hyperpigmentations, and your skin is so much more even toned, or your pores are a little bit tighter, smaller looking. And so amazing things that can be done with laser. And for now, as I'm aging, and some of my patients are aging with me, I think I'm starting to do laser for anti-aging, which is what it was actually designed to do. But, you can really give someone brand new skin with even just one good laser treatment. So for those patients that are good candidates, do not be afraid. It's an amazing thing.
Yeah.
It's a little bit of downtime. It's a little bit uncomfortable, but you'll have beautiful skin for
100%,
1 to 2, 3 years later. So
yeah.
awesome.
And ladies and gentlemen, gentlemen probably don't know this very well as much as we do as women, but we do so many painful things.
Oh my God.
That it's worth it. No pain, no gain. Okay. So some of these things, it's I'm sure they're slightly uncomfortable. But I personally would rather have a little bit of discomfort for the benefits of what one of these treatments is going to do.
For sure.
Yeah.
And I usually tell patients, most of our treatments, at least the ones we offer, I call it more social downtime. I mean, you can go to work, you're just going to look a little, a little red, irritated, maybe peeling.
Yeah.
But, for the most part, it's short, 3 to 5 days, and you can gain so much. So
it's nothing.
Yeah, it's nothing. In the grand scheme of things, it's nothing.
It's nothing. So, it's like a bad flu. You're going to stay in your house anyway.
Yeah,
just stay home.
Watch whatever you want to watch for a few days and, take it easy.
Oh, well, that's really good. So, and with lasers, I know that we briefly spoke about 2 different types of lasers and why you use the 2 types. So can you give us like a little bit of a breakdown? Like what you're
So for laser skin resurfacing, to stay on that topic, there are, several, well, not several. I think the 2 most popular lasers on the market are probably an erbium laser, a 2940, which is what I use, and a CO2 laser. Okay. They work, they both have an ablative, what we call ablative resurfacing, and both of them can be used to treat acne scars, deep wrinkles, tighten up the skin, treat some hyperpigmentation, and other cool things like removing warts and other kinds of fun stuff. Okay. But I happen to use erbium because it works best for individuals who are more skin type 4, 3, 4s. And so I have a lot of individuals who are skin type 3, 4, meaning like medium skin tones, or patients who can develop complications from lasers. So I have a lot more control with an erbium laser in terms of depth and strength and,
wavelength.
Yeah, the wavelength stays the same, but just the depth that I treat in the skin and the intensity. And so all these things can be modified to give you your unique treatment protocol that will give you, the best results in minimizing risk.
Okay. And then the CO2 laser, what is that? Is it the same?
It's another ablative laser skin resurfacing laser, a different wavelength, and the intent is the same to really, the name is what the name says it all. It's resurfacing the skin. Like we are taking off, your top layer of the skin. We are smoothing out your skin. It is really resurfacing. Like when you resurface your pavement, we resurface your skin.
Your skin. Yeah. I love that.
Yeah.
I mean, and it's like getting closer to like a facelift, but without having to go under.
For sure.
Right?
Yes. And, just the quality of the skin after laser skin resurfacing is amazing. I recently did a gentleman who he was like, he was there with his wife, maybe yes, maybe no. I'm like, try it. Try a laser skin resurfacing. And it wasn't even a very it was kind of a simple treatment for him. I didn't want to go too crazy. I didn't want him to have scabs and thinking what the heck is going on. His work schedule didn't permit too much time off. But by the time I saw him 6 weeks later, he's like, I love it. He's like,
I love it.
I love it. His skin was like baby skin, got rid of sun damage. His skin was tighter. His kind of fatigue under eye appearance was so much less. His nose was so much smoother. And he's like, basically, where have you been? I didn't know I needed this. And now I have it.
Yeah. Well, staying on the topic of men, because I know a lot of men are still kind of like weary about all of this stuff. Yes. But now I know that as women, our fatty deposits start to change. They start to move, just our natural fat.
Yes.
Are men going through the same thing?
Same thing. Okay. The aging process is very similar. Probably men are not as keen, or we don't notice it as much in men perhaps, but the same aging process. So we all age by losing some of our fat deposits. Our muscles kind of flatten. Our bones, kind of shrink. You lose certain edges. For example, your jawline is easy to tell someone's age by just looking at their jawline.
So sad. I know.
And so there's a lot of treatments to correct that, right? But anyhow, so yes. And then, of course, the skin, the skin laxity, and that varies from person to person. The texture of the skin, how much glow the skin has, how much light your skin reflects, all those things, usually go for, become duller as you age.
Yeah.
And so men and women age very similarly. And yes, men do come, I just want to say that men do come to get treatment.
Yeah.
I do have to say a lot of my men do come with their wives or, a significant other. But I'm starting to see more and more men who, once they have, their brother or their cousin, they'll refer someone else, and they'll feel comfortable coming into a place that's, traditionally, kind of a girly place, but it's not. Actually men do amazing with some of these treatments.
I can only imagine because, it's just like when men diet, they start eating like sandwiches instead of like full meals and they drop weight like nobody's business.
Or they take a shower and they do their hair and suddenly they look gorgeous. And I'm like, why?
Girl,
I take a shower. I don't look gorgeous. I need 2 more hours.
Exactly.
Right?
It
And
is
I'm
so
just
true.
like, what the heck?
Yeah.
But same thing. Men, you change the texture of their skin by just a little bit and they just look, they just look, they look wealthy almost. I don't know what's the best word to say.
Demure. It's true.
And that's when you were telling me, I know you were telling me, you worked at this dentist office where you had clients who, obviously had a bit more disposable income, and their skin was beautiful. And I'm like, it is true. You see someone and there's something about them that just yells, not wealth, but I don't know what other word to use, but kind of, you can kind of see it in their face. And it's not just that they are not, it's not
that
just
they don't have a care in the world
They don't
because they're
have a
just
care in the
like
world.
filthy rich. No, it's not.
It's not that
It's
because,
not that.
they care, they have, everyone has stress, but it's, what they have access to. Some of these treatments can really make a big difference.
Oh yeah, huge.
Yeah.
I mean, I've been witness to this, you guys, and I've seen it on women, and I am absolutely obsessed with lasers. I haven't met a Morpheus yet, but I feel like it's in my near future, because so something that we kind of spoke about and kind of deviating from the subject a little bit, but Morpheus can actually be used to tighten all parts of your body.
For sure.
Right?
Yes.
So we were talking about, you said the arms, like maybe belly after having like babies, the upper knee stuff. Cause y'all, maybe you won't admit it, but it is a thing.
It is a thing.
Skin.
It is a real thing.
It's a real thing.
It's a real thing.
Like love handles and stuff. So are you doing the same kind of, the same thing as the face as you would do on the
same technology, different pieces. So we have different pieces, like physical pieces, and then the way the protocol is different.
Okay.
So for the face, we want to focus on skin tightening without destroying any fat or minimizing any fat destruction. So we want to achieve like a nice, tight, glowy skin without destroying your fat, because you need the fat in your face.
Yeah.
Most people, even if you don't think you do, you do. The body, on the other hand, nobody seems to be missing an inch off their arms. Like, like, thank God.
Thank God we got rid of that little fat.
Yeah. Yes. Now that I'm, in my 40s, don't tell anyone. You start to notice things are hanging where they weren't hanging before. And I think your arms are a big one. I do arms a lot, belly, skin tightening, especially after having children, for women who can already see the stretch marks. As soon as you deliver, your skin sort of starts to come back and you're like, what the heck?
Yeah.
That's the perfect time to actually get a Morpheus in that first year, where we can do a lot of remodeling of your stretch marks and skin tightening. And so you'll get the best results if you do it, actually within a year of delivery. And we can do, for sure, your back, your love handles, your thighs, pinions, your lobes. You name it.
You can tighten it.
We can tighten it.
Yeah, that's so good. Well, and I know too, because we are in, like close to our 40s, or a little bit over 40s. But I noticed, like, with my girls friend group, that we're so about, trying to sleep better, being more cognizant about our what we're eating, what we're hearing, all of these things. And we're working out. But they do, like my girlfriends who have had babies, it's that little, no matter how much they work out,
Yeah.
they could be a size 2, but
Yeah.
it's still a little bit of that skin. And I know it's like, why wouldn't you wear a belly shirt? And then like, you just don't know
You
what
just don't know. Yeah.
I'm dealing with, you know? And even though for like somebody else, it doesn't seem like much, for us as women, we notice all those little
Yes,
things.
for
So,
sure.
and I think that's so empowering, right?
I think so too. I think my two favorite areas to do are the décolleté. So, of course, the saggy skin also affects our chest, and I think our the abdomen, the belly. It really does. And speaking from personal experience, it made a big difference for me. As I was mentioning, it's hard to want to wear cute underwear when suddenly you have all these stretch marks, and it is normal. I understand.
Yeah.
For those women who can like run with it, thank God.
Yeah.
But for the rest of us,
Yeah.
there's Morpheus.
There's Morpheus. There's something that we could do. And this is not to like create any like, self-consciousness. Like if you are that way and you feel great that way, then we empower you. But to know that there is something that can help and you don't have to, go under the knife or under
Correct.
anesthesia or, get pieces cut off. Like I'm sure that if there comes to a point that you're like, you know what, this is pretty much as Morpheus could do, I would recommend you, this other thing if you want a different, result.
Yes.
Then there's that too. But it's I don't know, for me personally, it's so comforting to know that I don't have to be put under to have a treatment like that done and still yield similar results or
or at least results where you feel comfortable with yourself.
Yeah.
And for, minimal risk. So yes, for sure. If you ever have questions, I always tell my patients, they're sometimes embarrassed to talk about things. I'm like, you're at a med spa. I mean, this is what I'm here for. This is as superficial as it gets, sweetie. Like, you can tell me anything. You can tell me anything, and I'll just, and I'll help you. I'll guide you. And I'll either offer you treatments, or I often recommend out if I can't offer you the treatment that you're looking for. And as I think any provider that people have, you should feel comfortable. And if they're if you're feeling like maybe they're trying to sell you the moon and the stars, then they probably are trying to sell you the moon and the stars. So just be cognizant of that. But, for the most part, I think most providers want to make sure that we offer patients treatments that they will actually appreciate, they can tell the difference, and hopefully they're good about setting the correct expectations. That's where I wanted to go. The expectations are so important. And I think once you set the appropriate expectations for an outcome, then and you're good with it, then let's do it.
Then it's a move forward.
Yeah, it's a move forward for sure.
Yeah, I love that. And I'm personally one of your patients. That's how we met. And one thing that I could always say is that I love the conversations before and the education because I didn't feel like I was going, across the border to Tijuana and like ordering off of a menu. It was like, no, this is what's going to be working best for you. And you're also trying to have long-term relationships at the end of the day, right? So you have to have somebody that's not only interested in their business, but also in your well-being and your overall aging journey, because it doesn't stop here. You're not going to get one treatment and then just say, I'm never going to age again. No, there's maintenance.
I wish,
right?
Personally.
There's no magical cream. There's no magical laser. Like we have to continuously have this type of maintenance if we want to achieve those looks. I mean, it's just what it is.
It is what it is. Yes.
So right now I know that, you're more traditional in the way that you use all these different modalities. But do you find that there's like something that's kind of trending right now that's, that you're doing more of?
I think probably the three things that I see more being done more frequently now are microneedling, either microneedling with radio frequency, which is like the Morpheus or PRP or some sort of plasma-like treatment. Sculptra is probably another one that I've started to see a lot.
We need to talk about
that.
We need to talk about that real quick.
And then lasers, I think people are coming around to lasers. We've had our, like I said, they've been around, but now I see a bit more of a trend towards lasers than I had before.
Most definitely.
Yeah.
So, and the reason why I made sure to come back and say we need to talk about Sculptra is that there is a huge trend right now with all of these weight loss, treatments and people losing weight rapidly. And now, like one of the most popular would be like Ozempic, where it's known to have Ozempic face. You mentioned Ozempic hands. So Sculptra. Tell us how Sculptra is going to help us. Where did it start from? Like, what is it actually doing?
So Sculptra's been around for a few decades now, and it started off as a treatment in individuals who had AIDS and had facial atrophy, and it was used to kind of regenerate or replump their face. And of course, it quickly crossed over to the general market, and now is used exactly to do that. So great candidates for Sculptra are women or men, actually. I mean, patients, individuals who are starting to see a little bit of facial atrophy. And by that, I mean kind of the gaunting or the hollowing out of your cheeks. Your skin is starting to kind of crepe or fold over itself. You're starting to get these little lines that are what we call static lines, things that you don't treat with Botox. Usually Botox is the upper third of the face. Once you're dealing with a lot of static lines or lines in the lower third of the face, and Sculptra is probably the right thing for you. It's a treatment that is injected subcutaneously into the skin. So it goes underneath. You do use needles. And starts to regenerate collagen and some fat cells. So there's a little bit of fat regenesis. It's known to be a collagen stimulating treatment. And within about 2 to 4 months, you get to see kind of the final product. So it's a slow acting treatment. But then your skin is just more firm. Think of baby skin. You can, pierce it. There's a little bounce. Yes. Yeah. A little bounce to it and glowier. That's what Sculptra will do for your skin.
I love that.
Yeah, it's awesome.
I know when we started talking about this, I was like, wait a minute. I'm like, maybe Sculptra is really it to start off with. Like, because I know that there's a lot of people that are like scared of the fillers and scared of like the Botox and things like that. But this seems like a very non-invasive way of just regenerating your own development of the collagen and production, I should say, the production of that.
It is. I mean, I would say non-invasive is probably not the best.
Not the way. Okay. Correct me, girl, because you're the specialist. I'm not.
I want to say yes to that, but I can't.
Yeah.
I mean, it is. I mean, we do have to penetrate the skin. So there is, it's minimally invasive is what I say. Yeah. Minimally invasive treatments. And that's, really what what I do. So there is, in the grand scheme of things, minimally invasive, and and it can have some awesome results. But again, always consult and make sure that you are a right candidate, and get the right information.
I mean, thank you for correcting me too, because this is why you're here. This is why you're here, because I'm sure that there's plenty of us out there, right, that are like, well, this is what it's gonna do. This is like, it's so non-invasive, but then you come out and you're like, wait, there was needles involved. So thank you.
I don't know what you were imagining, but yes, there's needles involved for sure.
Some needles. So just some really quick tips and stuff for when our clients are looking for these medical aesthetics. Yes. What do you recommend, for them to look for? We already talked about, having a medical director, a clean place,
Yes. I think, yes. So having a medical director, a clean place, an establishment, having a sense that you can reach them, you have access to them. There's an office, someone you can talk to. They've done at least some sort of medical intake, emergency contact information, really basic stuff. Like think of when you go to the doctor, and if you went to the doctor and were complaining about belly pain, but they knew nothing else of you, you'd be a little bit like, oh, that's kind of weird. So it should somewhat feel like a medical visit, but the focus here is just your beauty, your skin health. But it should have a sense of professionalism to it. Again, trust your gut. If you don't feel like something is jiving with you, then it's not the right place for you. don't jeopardize yourself over an aesthetic treatment. There are plenty
Or
of
to try to
options.
save a buck, because I know.
Oh my God, yes.
I know a lot of people are like, oh no, well, I found an injector that does, Botox for $5 a unit. And you're like, well, we did run into that thing, here in Illinois,
Yeah.
where there was a lot of like
Counterfeit Botox.
So
Yes.
be careful, because these things can actually, and it could potentially be catastrophic, right?
They can. I mean, for the most part, most of what we do is very, very low risk. But there are potential risks, and you don't want to sacrifice your face, your health, permanent adverse events over saving yourself. What seems like $100, like great, it's $100, but
Yeah.
sometimes it's not worth $100.
And then what about the correcting? Like how much you're going to pay to correct that one?
Yeah.
And then what if there is like irreversible damage? Then it's like the rest of your life.
Yeah.
So be wise, guys. And I know that you recommended to start slow.
Yes.
Be consistent.
Yes.
What does starting slow look like?
Yeah. I think it starts off with a really good consultation. Like go somewhere where they are looking at you, they are listening to you, where you feel like you're understanding each other in terms of what you're looking for. You should get a sense that they're being relatively transparent with what you're signing up for, what you're going to obtain, what's the post-care like. Don't go in there and have nobody say, oh, we're just going to inject you, and that's it.
Yeah.
Or, I've had patients who are like, well, I just would sit in the chair and they would just put Botox in me. I'm like, how many units would you get? I don't know. What brand of filler did you get? I don't know. How many? I don't know. And I'm just like, what do you mean you don't know all these things? Yeah. And I understand it happens. But, take some, make sure that you do understand what is being done to you.
Yeah.
And so starting slow, I think, is working out a treatment plan, understanding why you're doing it this way. Because in the end, any effective treatment plan, especially if you're in your 40s, 50s, you're talking about a few $1,000s, and that's quite the investment. So you just need to feel comfortable with where you're going.
And so now in developing that trust with your provider and all of that, is there or are there any resources where we can look up medical providers, or like say, can we look up Très Jolie Med Spa somewhere to know that this is
a legit business? Yes.
And that there's a medical provider behind it.
Most places should have a medical provider listed on their website.
Okay.
I think by law, that's a requirement, if I'm not mistaken, is to have a medical director listed. You can also just look up any any physician and make sure that their license is active. You can do that through, just probably a Google search. But just like you would have to maintain the same, I think it's the Illinois Department of Professional Regulators. Oh my God, I'm totally butchering up their name. Even though
the IDPFR, that's what it is. Yeah.
They manage, they oversee licenses in all kinds of different industries. And so you can look up a physician and make sure that they have an active license, You could look up to make sure that they haven't have a medical complaint or something of that kind into the medical board. I mean, there's lots of different things you could do.
Yeah.
But I think just ensuring that someone has an active medical license is probably
first and foremost,
or just understanding that there is a medical provider somewhere.
Yeah.
Somewhere in there.
And just so you guys know, like the IDPFR is open to the public. You don't have to be a licensed professional.
Yep.
I thought that it was only like beauty industry real estate licensing that was under there, but you can now we know that you can also find your medical providers on there.
Anyone.
Yeah, that's awesome.
Yeah.
That is awesome, because I mean, you can't beat that. That's regulation. That's you have to pass that. You have to have your continued education hours, all of that stuff to keep those licenses up. And it's regulated by the state. So it's not just an organization that develops
Correct.
this.
No, this is, it's there for the safety of the individual. So,
So I am just so excited for having you here. And thank you so much for the wealth of knowledge. I feel like we touched upon so many different aspects. And I'm just happy to know that there's lasers, Botox, fillers, Sculptra, all of these things to help us age gracefully.
And don't forget your home skin regimen.
And the home skin regimen, okay? Because that's another thing too, you guys, is that we were talking about this before, that it's like a 50-50.
Yeah.
You can't expect to go to a specialist and have all these wonderful treatments without protecting your investment,
Yeah.
which means your at-home regimen,
Yes.
SPF, SPF, SPF.
100%, 80% of aging is due to sun damage. So please. Yes.
You heard it here. I mean, we
Yes.
all hear it, you guys, but this is actually a licensed doctor, telling you
real.
that protect your skin from the sun.
Yes.
Even when you're driving, there's that notorious picture of the semi-truck driver, right? Where you see half of the face is just like wrinkly and droopy and just really aged, and the other one is nice, aging gracefully like
Correct.
a man or a woman would normally. So we thank you so much for your expertise.
You're welcome.
And
Thank
if you need any of these things, she is actually located in the beautiful neighborhood of Pilsen.
Correct.
So you can go get services done and then go shopping, go and have dinner with your girlfriends. Make it a fun thing. You guys, the neighborhood is so much fun. And your clinic is just beautiful.
Thank you.
It's beautiful. It really is.
Thank you.
So you heard it here first, and you heard it from the specialist herself. And I just want to thank you guys for tuning in to this episode of Beauty Talk Podcast. A huge thank you to our guests for sharing all this invaluable insight and, helping us get more well-rounded with the world of medical aesthetics and helping us to better understand the science and artistry behind these treatments. If you're considering any aesthetic therapies or want to learn more, this episode is a must listen. So don't forget to subscribe and follow us on social media and visit our website at beautytalkpodcast.com to stay up to date on all the upcoming episodes. And we would love to hear your feedback. So leave us a review and let us know what other topics you would like us to cover. And the final shout out to G Skin and Beauty Institute for making this possible, and share this episode with all of your friends. And until next time, stay confident, beautiful, and informed.